yeah, you lose everything. It's a feeling of losing, and the feeling of uncertainty, and feeling of divided into pieces, because Ukraine is still your home, your country, your motherland, and now you're somewhere else, and it's hard, painful, and strength to every day wake up and do things. Of course, everyone experience war differently, but in general, war causes a lot of problems for people, and these problems open up within time, not at the beginning usually. At the beginning, when people run away, they have a lot of this adrenaline inside, and they are ready to struggle, ready to fight for their future. But later, this adrenaline gone, and person start to feel this hopeless more and more. And then we as psychologists face all these problems that come. War is different from other catastrophe which happen because it's very strong beginning and never you know when it ends. There is no ending, and every it's re-traumatization. Every day it's again and again. And if some people was running away, but they still have family in Ukraine, maybe now the family already dead. Maybe people was having place where to come back. Maybe now this place is gone. So that's why it's like the feelings that you couldn't change anything, you know. People go to psychologists, people work on themselves to improve themselves, to grow. But when it's war, you understand that this factor you couldn't overcome. It's something that you couldn't do anything to deal with. And when people come with anxiety, with scary disorders, they come and say, yeah, help me. But sometimes you see that the reason is war, and you couldn't help because you couldn't stop the war. All you can do is give them a little bit more power and a little bit more resources to hold on, but you couldn't change it. That's the main thing that make this work with such people very hard. In the beginning, we see that first request was about emotional things. Yeah? I worry, I scary, I crying all the time, I feel depressed. That was the first request from people, and the most often such request we hear. And also behavioral, I have a lot of tension, a lot of aggression. I sometimes I just give up, like I couldn't stand up from bed. And also we have a lot of cognitive things, like people say it's very hard to remember something, it's very hard to concentrate. But in time, after 1 year, we see how this request has changed in a different way. It starts to be more complex. So people don't talk anymore that I'm sad or I feel worried. They talk about I couldn't stand up from bed, I don't want anything, I scary, I worry, and it's a complex. It starts to be more look like some psychological disorders. And also we start to have a lot of requests from psychiatric problems. And I can say that as long people in this state, in this tension and this worries, as harder problems they have, as harder it's inside, and as harder it become to come to doctor and to start to solve these problems. Prevention is, I think, number one, what people who work with Ukrainians on first line. It's prevention on psychoeducation. It's first what they can do. It's talk about their feelings. It gives opportunity to people to show these feelings, because usually people have it inside, and it's also our little cultural things, Ukrainians, that we not share much. If we have problems, we hold them inside. We not share with other people. Sometimes with family, with closest ones. But now, as you know, half Ukrainian family and half Ukrainian groups are divided, separated, and people don't have with whom to talk. That's why they're gathering inside, and what people who work with them can do, it's just open up this, just give them safety to talk, safety to show feelings. It's first step to release this, to relieve this trauma, to support people. It's actually a big problem for all people who work with Ukrainians that people don't want to open up and then don't want to take a help, but it's also about Ukrainian stigmatization of mental health. In Ukraine, long time it was mental health and mental hospitals was more like punishment. You know, if you come there, you wouldn't get out, because it was at the time of Soviet Union. It was a mechanism to punish people who was thinking differently or talking differently. That's why it's still in generation that people afraid of help exactly in mental field. What can people do to help, really? They can be very transparent about it. They can talk very openly and say what the consequences it can bring. That if we go to doctor can give you a referral to a psychiatrist, and it will be just help. It doesn't cause you anything. It doesn't make anything for you, because people in Ukraine also afraid that if they was once in mental hospital or go to psychiatrist, it will be subscribed somewhere like forever about them, and they would never find a job, never have a good life, never go somewhere higher. But it's not true. It's actually not like that. And it's very important to talk with them. And also, if you see people really suffering, you need to ask person what person wants. What really is the idea to move, where to move. If person say, I just want to sleep, maybe you don't need to say that, yeah, you need to go to psychiatrist, but you can say, yeah, if you want to sleep, maybe you need some special help, like maybe talk with doctor, he will tell you some tips how to sleep better. Or if you want to be able to go to work, or to be able to talk normal with your kids without aggression or screaming, maybe you need support from social worker who will just talk with you. And first, always start to give like hand and wait when person will take it, but do it all the time, because also our cultural things to not say no at the beginning, but we need a few times people to ask us, and we will say, yeah, okay. Then we will see that person really want to help. It's not just polite, but it's really, really willing to help. But social institution in Ukraine doesn't work so good like here they work. And if people have something to do with social workers, they look at it like a punishment. They don't think that it's really help, because in Ukraine it doesn't work to help. They appears when it's very, very bad, something happened. But here it's like normal to ask for advice, to hear for opinion, and people really have help. I see how Netherlands people so much go to different institutions for help, and Ukrainians are afraid of it, but also they don't know about it. They don't know anything. So it's important to give them information, and it will be good to give them information that they will understand it. Maybe also this language sensitive things important, because a lot of people couldn't speak and they shy also about it. Of course, a lot of Ukrainians also can overcome by themselves, but mostly these people stay in Ukraine now. The people who can overcome, they stay to protect their house, their home, and do it. And mostly people who run away from war, these people are really more weak. We see a lot of people who come with different disabilities. We see a lot of women with kids. You don't see healthy men here. You see women, kids, and lonely old people. It's all people who is from this vulnerable, let's say, sector, the people who really need this help. Of course, even from these people, we see a lot of people who can overcome by themselves all these problems. And sometimes they need just one talk, one advice, and they can also do things to improve themselves, to live better. But a lot of in this group really need special help. And because of war, because of situation, a lot of people run from bombing, and they were sitting, before they can run away, they're sitting in basement for weeks. They don't have what to eat, what to drink. And when you don't have these basic needs, it's not cover your basic needs, then of course you feel worse and worse. And that's why now we have so much damaged people here. I would say for sure what not to do, it's not judge people. It's because it's important, because people wait from you support. They wait understanding. That's number one, what you have to give. Not judge them and not to complain about them. It's very good to talk with them, very good to open up. And also not to show strong emotions, because people who have trauma, they are very afraid of strong emotions from other side. So it's very important when you talk, be calm. I would say that all specialists who work with Ukrainians have to work on themselves first, on their emotions, on their reactions, and then start to work with other people, because people react on your emotions very much. It's like, mirroring. They look at you and they get your emotions. Mm-hmm. And if you're really calm and really sure that you can help, person will get it from you, and also will start to be calm and sure that they will have help. And make these guidelines to people, to show them how it works, to explain them where they can go, with which problems, to whom to go, and how they will get help, and consequences of this help, because it's also very important. Because sometimes people are afraid to go because they don't know what will be a consequences. Even very easy. Sometimes people don't go to psychologists because they're afraid that it will cost a lot of money. but actually it's under insurance, and a lot of people don't know it, so it's very important to talk about it. And also it would be nice to make psychoeducation programs or integration programs at location where people live, just to explain them how things goes and show the culture and show that this culture is open. This culture is open for you, and if you want, you just step here and we will support. It's also what people miss a lot. A lot of people come back to Ukraine because they feel support there, not here. But this, to feel it here, they just need a small bridge to build. It's always start with conversation, with open conversation. The main tips is just to talk transparent, to talk, to be open to talk, to willing to help people. And if you give a hand to person, you say about what you can offer, what you can, so in what you can support them, you give this information, then people will take this responsibility on themselves and they will come to you and say, okay, can I get this? Or what can I do if I need this? So to build bridge, number one is to give information about how everything works here in this country. First, you give information and show that you want to help, and then you make this connection between people, then you show that you are strong, you are calm, and you can share this with other people. You give these emotions. It's like infection, you give your emotion to other people and people feel it. Why people feel more calm with the strong people? Because someone who have inside a lot of power, they can also give this power to others. They share. It's like how to work with people. When you are sure in yourself, sure that you can help, you will help, and it will work, people believe you. But Ukrainian mental health system changed a lot, and it's in better way changed. And I can say that younger people, like people after who younger than 30 years, they are more open to ask for help. They are coming for help. I have a lot of clients for 14 years that they come and say, can you help me, please? And then you need to say, okay, but you need to bring your parents, but kids by themselves won't help. In Ukraine, if you need help, you just go to psychiatrist, to a special hospital. You don't go to general practice for such help. So it's very important to show this route and say how it works, and maybe interview with some doctor who will explain how it works. Also will help a lot. Yeah, of course, when you have this judgment for anyone, first what you need to do is just to look from different perspective. You just need not to listen for what neighbors say or look at me. Just look by yourself. Just come start to talk. Just maybe read more about Ukraine. Maybe look more about Ukraine if it's interesting for you to see, why it can happen like this. You can come to people and talk, because people can look grumpy, but when you will come and really be wondering about experience, people will talk with you. People will share with you. They will show. It's just inside of person. Now, if you don't want to judge, you wouldn't judge, because you will open up yourself. You will look at different perspectives. Maybe it will help, I don't know, to put yourself on, in your head, put yourself on other place of that person and think why person feel like this. But of course we couldn't feel the war if we wasn't there. We couldn't feel emotions if we're not in this place. But we can just imagine about it. Maybe also it's important to say that don't forget all the time that people still have war and still have re-traumatization, and that healing of these people is not so easy. It wouldn't work like with maybe other groups of people, because we're still on this and we're all the time on this. And Ukrainian is not a refugee like in a normal way. They are temporarily displaced, and it brings a lot of anxiety for people, a lot of unsure on people. And that's why sometimes you need to have it in your head when you talk with people, and then you a little bit differently build your conversation. Because you couldn't say that you have to integrate and live here, because you don't know how it's inside for person. Maybe person want to come back. And it's a very big pressure from side of Ukraine also, that people move and some stay. And it's very hard when half of your family is there and you are here. So it's very important to keep in mind this.